Today we're going to be looking at the article My Medicare Promises Better Healthcare, but only 1 in 10 patients has signed up. So first I'm going to read the article, and then we're going to go through it bit by bit, talk about each section, and then we're going to discuss it as a whole and what we think. So My Medicare is a scheme that encourages patients to register with a regular GP practice to improve their health, but few patients have enrolled. Since its launch in October 2023, only about 10% of patients have signed up. The Albanese government's 2023 to 24 budget allocated $19.7 million over 4 years to implement MyMedicare. So if we are to get value for money from the scheme, we need to find out why patients are not signing up and address any barriers to them doing so. Other countries have similar schemes, as we outline in recent research. Here's what we can learn from these to boost uptake of MyMedicare in Australia. MyMedicare is a voluntary patient registration scheme. Patients nominate a GP or GP practice as their preferred provider and see the same GP or healthcare team over time, a concept known as continuity of care. Continuity of care is linked to earlier detection of health issues, better management of chronic long-term conditions, fewer avoidable hospital visits, and improved patient satisfaction. Patients registered for MyMedicare have longer telehealth consultations. People living in residential aged care have more regular visits from their GP. From July this year, GP practices may offer patients more support for their chronic disease. There are also benefits for GP clinics that sign up for MyMedicare. They receive incentives to offer certain patients longer telehealth consultations. Practices also receive incentives to maintain the health of registered aged care patients. These incentives help practices invest in improved services and resources. From July, this may include better chronic disease management and enhanced team-based care, for instance, better liaison between GPs and allied health workers as part of someone's health team. How many patients have signed up? Since MyMedicare's launch in 2023 until March 19th of this year, more than 2.6 million patients have registered for MyMedicare, according to the Department of Health and Aged Care statistics provided to the conversation. That's about 10% of Australia's population. This raises concerns about how aware patients are of the scheme, how engaged they are with it, and possible barriers to registration. GP practices that provide services to patients who will benefit from the new longer telehealth services or provide care to people in aged care were encouraged to register those patients in MyMedicare as a priority, so perhaps other patients have yet to sign up. GP practices have been quicker to sign up. Since its launch, Health Department statistics provided to the conversation show 6,469 practices had registered for MyMedicare until March 19th of this year. That's about 80% of GP practices in Australia. We don't know which patient groups sign up for MyMedicare. The Health Department told the conversation patients can provide details of their sex, location, such as metropolitan, regional, rural, and remote areas, linguistic background, and disabilities when they sign up. But this is voluntary, and these data have only been available for collection since March 2024. However, here's what we learned when we looked at other countries' patient enrollment schemes. Men are less likely to enroll than women, and recent immigrants have significantly lower registration rates compared to long-term residents. These highlight potential barriers to access for certain populations. Patients in suburban, rural, or small urban areas have higher registration rates, whereas those in large metropolitan centres and lower socioeconomic groups register less. Patients with mental illness or substance use disorders have lower registration rates, pointing to challenges in engaging vulnerable populations. We also looked at how other countries set up their schemes to see what we can learn. New Zealand has successfully implemented a voluntary patient registration system by offering incentives to enrol patients. These include lower co-payments for consultations and cheaper prescriptions. This approach encourages people to register with a general practice rather than a specific GP. Some 95% of the population was registered by January 2025. Quebec has several voluntary registration programs for different groups of patients. These include ones for family medicine, vulnerable patients, and general program. However, registration rate remains low at 14.7 to 32.2%, depending on the program. British Columbia offers 3 voluntary registration programs, one for chronic diseases, another for complex care, and a general program. These use capitation funding, where GPs receive payments based on the number of patients they care for. Participation rates vary widely across the three programs, with 45.5 to 79% of the population registered. The differences in registration rates across these systems highlight the importance of how schemes are designed and implemented. If MyMedicare is to improve access and continuity of care, targeted strategies such as outreach for immigrants and lower income groups and better support for people with mental health issues will be essential. Australia could look to how countries with higher rates of patients signing up have designed their systems. This could include considering whether more financial incentives for patients to enrol is warranted, which has been successful in New Zealand. So my first thoughts are, I haven't actually heard of MyMedicare, like as a program or a scheme before. So this sort of highlights the point where they mentioned before awareness of the scheme. And so that's my first thought. Maybe there needs to be increasing awareness in order to get more people to sign up. So let's actually, before we go through the article again, let's look up MyMedicare and see a bit more about what it's all about. Because the article obviously described it briefly, and it sounds like it's to register so you have one GP. Anyway, let's have a look. So according to the health.gov website, aims to formalise the relationship between patients, their general practice, general practitioner and primary care teams. Yeah, it's interesting. I'm still not fully understanding, I think, what it's relating to. So let's look at benefits for patients. Let's see, why would you want to sign up for MyMedicare? So it's interesting. It looks like you're just registering your regular doctor, or as in, if your regular doctor is registered, you can sign up for MyMedicare and say that that's your regular doctor. And I can't immediately see what the benefit of that would be, other than the continuity of care, but you can do that by seeing a regular GP anyway. So it seems like they do need to incentivize the MyMedicare scheme a bit more as well, and at very least make it clearer what the benefits are. So I think another problem with MyMedicare is, this is completely anecdotal, but I don't see a regular doctor. I have a look at what's available for an appointment that will fit in with my work schedule. And so obviously not having a regular GP means I'm not getting that continuity of care. And I don't know how MyMedicare is aiming to solve that. And I'm not saying that's a problem that I have personally. I'm quite happy seeing different doctors and not getting that continuity of care. But clearly the government's interest in MyMedicare is to encourage people to have more continuity of care and see the same doctor, over an extended period of time. So let's have a look at, I don't think we'll go through the article bit by bit. let's talk a bit about let's look into a bit more about the conversation around MyMedicare. So if we look at MyMedicare Reddit, maybe. Okay, so this is Reddit thread talking about the exact article we've read. And the top commenter said 19 days ago that they were completely unaware of its existence. So that's sort of the problem I was highlighting earlier, that I hadn't heard about it either. And this person who claims to be a doctor also says they haven't heard of it. So to me, that seems like it really is the biggest failing, that they haven't pushed this scheme and made people aware of it. This person says that they've seen no financial benefit. For me as a patient, it hasn't made any difference. This person's got a good summary. Here's a couple of reasons why people aren't signing up. Not well advertised. People that had to move around regularly. So that's a good point I hadn't thought of. What if their GP leaves practice? That happens a lot. Or I think it's a stretch to say it happens a lot. But it is a good point to raise. You know, how can you sign up for MyMedicare and say this is now my registered GP, and then they move away? What happens then? So it's really interesting because as we've seen, while it's good that they're trying to support healthcare in general, the Albanese government has allocated $19.7 million towards this program that they haven't pushed and has no clear patient benefit. And so with that in mind, we have to consider if maybe that money could have gone somewhere better. Because recently we had the doctor strikes, and while that wasn't all about money, it was mostly about working conditions, and we'll probably do an additional video on that another time because that's a whole big topic that we can cover. I think we need to consider if that money could have been better spent. But I think that's the majority of what I can get out of this article for today, and we'll touch back on it again if I think of something else we need to consider. And until then, that's about it.